Okay, let's go through the male reproductive system. First, let's start down here. This is the scrotal sac, and inside we see the testes, and this is where meiosis is occurring to form the spermatids. And then the spermatids are going to be matured here into active swimming sperm, and that's the epididymis. It has a head, body, and a tail. Then the epididymis is continuous with the Ductus Deferens, and we see the Ductus Deferens traveling through the inguinal canal back into the body, and it loops over the ureter. Now, this is something that students fail to recognize. This is just a little piece of the ureter coming into the bladder. So the Ductus Deferens loops over that, and you can see that it is going to merge with the seminal vesicle. And when that happens, this creates the ejaculatory duct, and I'm going to show you that here. So this part right here is representing the ejaculatory duct, right there, which is dumping into this structure called the prostate. And the prostate and the seminal vesicle both are making fluids that are going to contribute to the ejaculate. The seminal vesicle makes 60% of the ejaculate volume, and the prostate makes on order about 30% of the ejaculate volume. And in that fluid, we find clotting factors to help keep the sperm in the vagina. We also find liquefying factors. We see that it has sugar components, and then again, that's for the nutrients for the sperm. And then finally, we're going to see that the urethra leads from the bladder, travels through the prostate. So this part of the urethra that's traveling through the prostate is called a prostatic urethra. Then we see a part of the urethra going through the body wall, and that's the membranous urethra. And then the majority of the male urethra is found in the penis, and that's called the penile urethra, or also known as the spongy urethra, because it is found in an erectile body called the corpus spongiosum. Now, this erectile body that you're seeing here is paired. There's one on either side, and those two together are the corpora cavernosa. Now, up at the tip here, this is the glans penis, the part that looks like a helmet, and this is the foreskin. And on this side of the model, it is uncircumcised. And on this side of the model, you can see the glans penis has been removed from the foreskin. And just going back here to the bladder, we can see macroscopic folds, and those are called rugae. Now, we don't really have an official model that shows the bulbourethral gland, but we just kind of say it's right here. And the bulbourethral gland is also contributing to the volume of ejaculate, about 5% of the total volume. Okay, one more thing to point out, and I'll show it on this model. This entire structure is called the spermatic cord, and we find a nerve in there. We find the testicular artery. We find the testicular vein, which at this point looks like a web of veins around the testicular artery. So this is called the pampiniform plexus. We also find lymphatic drainage as well, and the ductus deferens, as I said before. So you can review all the components of the spermatic cord for lecture in your PowerPoint if you want. Now, also shown here on the side, you can see where the inguinal ligament is creating this kind of triangle type shape, and that's called the femoral triangle, and this is where the femoral artery and vein can be found. And this is a site where someone could have a hernia, although that type of hernia typically is found in females, not so much males, because females have a wider hip and therefore a larger femoral triangle, and it's easier for the intestines to breach through that space. And this model, I think, has a nicer presentation of the inguinal canal, and there's an internal ring and an external inguinal ring, which basically means a space for these structures to enter and exit through. And it is more common, speaking of hernias, for a male to have an inguinal hernia where some of the intestines get through that inguinal canal and then they present down here in the scrotum. And I'll remind you that the scrotum has smooth muscle that is found around it, and this muscle contracts to help elevate the testes to bring them closer to the body, or it can relax to allow the testes to drop further. And that's necessary because the sperm development needs to occur about 3 degrees cooler than body temperature. So it's important that this spermatogenesis occurs outside the body where it is a cooler temperature.